Good day. Today we were going to talk about the disease tuberculosis. Tuberculosis or TB is a bacterial infection that primarily affects the lungs but can also affect other parts of body such as kidneys, spine, and brain. Tuberculosis causes. This disease is spread through the air when an infected person coughs or sneezes and someone else inhales the bacteria. TB is more common in places with poor ventilation, crowded living condition, and a high incidence of the disease. Other factors that increases the risk of tuberculosis include weakened of immune system such as those with HIV or diabetes and exposure to someone with active tuberculosis. The symptoms of tuberculosis. It can vary depending on the stage of the disease. In the early stages, there may be no symptoms at all. However, as the disease progresses, the following symptoms may occur: coughing that lasts for more than 3 weeks, chest pain, fatigue and weakness, loss of appetite, weight loss and night sweats, chills, and fever. It is important to note that these symptoms can be caused by other conditions as well, and not everyone with tuberculosis experiences all of them. If you have any of these symptoms, it is important to see a healthcare provider for an evaluation. The prevention of tuberculosis involves several strategies including: Number 1. Vaccination. The BCG vaccine is used in many countries to prevent severe forms of childhood tuberculosis. Number 2. Infection control. Good ventilation, cough etiquette, and wearing masks can help reduce the spread of tuberculosis. Number 3. Screening. High-risk individuals, such as those with HIV or close contacts of people with active tuberculosis, should be screened for TB infections. Number 4. Treatment. Treating people with active tuberculosis can help prevent the spread of disease. Number 5. Prophylaxis. Giving medication to people with latent tuberculosis infection can help prevent the development of active tuberculosis disease. Number 6. Improved living conditions. Crowded living conditions, poor nutrition, and lack of access to healthcare can increase the risk of tuberculosis. Improving these conditions can help prevent tuberculosis. Number 7. Education. Educating the public about tuberculosis transmission and prevention can help reduce the stigma associated with the disease and encourage people to seek treatment. Cure. Tuberculosis is treatable and curable with appropriate medication. The medication regimen typically involves a combination of antibiotics taken for several months. The exact treatment plan will depend on the individual's age, overall health, and whether the TB infection is drug resistant. It is important to take all medication as prescribed and complete the full course of treatment to ensure the disease is fully treated and to prevent the development of drug-resistant TB. In some cases, hospitalization may be required for people with severe or drug-resistant tuberculosis. Regular monitoring and follow-up with a healthcare provider are also important to ensure the effectiveness of the treatment. So once again, I am Andriane Tizon, and this is the disease that I present to you, the tuberculosis. Thank you!